Today I'm going to be talking about a drug that most of us have heard about, and the drug is Remdesivir. Remdesivir is an antiviral drug and it's available to us since 2020, and we've still been using it ever since 2020. Now, what about Remdesivir? Now, clearly Remdesivir is an experimental drug which has been granted emergency use for the pandemic of 2019-20, namely SARS-CoV-2. Remdesivir does not decrease the mortality. That's what studies have shown us till now. So what does Remdesivir do? Remdesivir actually decreases the length of stay or length of hospitalization of a patient who's suffering from SARS-CoV-2. Does every patient suffering from SARS-CoV-2 require Remdesivir? Clearly not. The indication is absolutely clear-cut. People who've got a moderate to severe disease and who require oxygenation require Remdesivir. That means people who are in isolation, quarantine, people who've got no symptoms or so-called asymptomatic or mild disease patients are not candidates to receive Remdesivir, and that should clearly be understood by everyone. Remdesivir is to be administered only intravenously, and therefore the guidelines strictly tell us to use Remdesivir only in a hospital setting and not to be used at home. So that's very absolutely clear that Remdesivir should only be administered in a hospital setting. It's to be given intravenously. It's not to be given orally or in the muscle, only through an IV line. That's again a point that we must remember. Now, Remdesivir is best used early in the disease but can be used up to 9 to 10 days of illness. And I've told you it's only to be used for patients with moderate to severe disease. So why this hype of Remdesivir? Why should people hoard or black Remdesivir? I think it's important that if you are not a candidate to receive Remdesivir, you should not be getting Remdesivir. You should not be hoarding or storing or saving Remdesivir for a day tomorrow. The person or the patient who needs it today will be deprived of it. So I sincerely urge every viewer to make sure Remdesivir is used judiciously, correctly, not hoarded and not blackmailed. Unnecessarily irrational use of Remdesivir is going to cause further shortage. So please be mindful of our actions. Thank you.